Welcome back to another episode of the Real Results Show, where we are interviewing real practitioners who have real results for themselves and their clients. I'm your host, Evan Transu, aka Health Coach Ev, and I might not be your host coming up soon. I got to see where FDN's going to throw me, but if just in case I am not here, I've loved talking to you guys, and I know that you will have someone cool coming up. Probably, well, I'm actually not going to spoil that. I'll keep that top secret. And there's a good chance I might be back. They might recruit me, so we'll see what happens. But today I am here with Dr. Jeannie Lopez. So first of all, Jeannie, thank you so much for being here with us today.
Thanks so much for having me, Evan.
We had done an interview together for the FDN Thrive podcast. I am the host of that, and we just talked forever on there. And then like off the record, we talked for probably another like 45 minutes or an hour. I was just so appreciative of all the knowledge you shared with me and all the insight you gave, but definitely check that podcast out too. If you're listening to this and you're like, I'd love to learn more. We have less time for the Real Results Show, but there we have just kind of free flow conversation and a lot more time to talk with the guests. But nonetheless, we're going to talk about some cool stuff today. So the theme, and it's actually something that kind of relates to Jeannie's overall business, which is cool. It's a paradigm shift of health and well-being. So let's backtrack for a second and talk about how you even came to that. So Jeannie, what is your background, and both in actually career-wise and health-wise? Let's start with that. And I know that's a loaded question.
Well, Evan, I'm a clinical neuropsychologist who works with children, adolescents, and families, and I assess children for learning disabilities and ADHD, autism, and things like that. And we also specialize in giftedness and twice exceptional. So children who are gifted and also have struggles, could be anxiety, depression, and any of the other things I mentioned. So that's kind of my first love and my first job. And then my health journey has taken me to become an FDN coach. And I just got finished the program in December. And I'm working in the FDN Thrive coaching group now, and trying to start my business. So that's where I'm at right now. So I have a long health journey. So that's kind of what got me to the paradigm shift wellness name for my business. I grew up with health issues, and I just kept collecting more and more every decade is kind of what I say. And when you have that many issues to deal with, you study things, you read, you listen to podcasts, you talk to people. And over time, I really had a paradigm shift. My whole view of health changed. And that's really, I think, what led me to FDN and really led me to really bonding with all of the theories and the ideas behind FDN and why it works. So, not looking at symptoms directly, not giving medication for everything, but kind of looking at building health through a variety of ways.
Yeah, and the simple way I always explain it, and it's not a perfect analogy, but it's pretty dang close, is just, if you cut your finger by accident cutting vegetables, or you get a paper cut or something, right? Well, what do? Do we tell, oh, finger, you need to heal? No, we stop messing with it. And the body does this magical thing that we have no conscious control over. And there we go, right? And so really, in the most simplistic terms, what we're doing is FDN, that those theories and ideas that you're talking about, is just that ability, but for chronic health issues. And so it's a lot more complicated, though, than just taking away the paper cut, or not using a super sharp knife in an inappropriate way when we're cutting vegetables in the kitchen. Like, it's a lot more deep than that, right? So we learn about a bunch of different things. In this case, like, we're learning about the different papers, we're learning about the different knives. We take those away and we allow the body to do its natural healing thing. So you were talking about briefly your own health journey and kind of an extensive history with health issues. What were some of those things that you experienced specifically, and when did they start?
I think pretty much everything started from birth. I was a colicky baby, had digestive issues. Then as I got older, allergies and asthma. And then then the next one was migraine headaches, arthritis, celiac disease, pancreatic insufficiency due to the celiac disease, some more GI issues. The arthritis kind of got worse. And then in the last 5 to 10 years, more hormonal issues, and Lyme mold toxicity. And I think that kind of sums it up. So, I've visited all kinds of health professionals, from physical therapy to a massage therapist who does frequency specific microcurrent to, functional medicine MDs, naturopaths. I mean, pretty much anything I could kind of learn about, I was up for trying after a while. Because when you're in pain and you're tired, you want a solution. So
Yeah, and you hit the nail on the head because we are, and you actually said this before, we're looking at podcasts, we're reading book or listening to podcasts, reading books, and it's wonderful to do those things. But what's tough still about the functional health world is like, where is there a place where we can go and not just have to collect these random pieces of the puzzle, but we can actually, get the puzzle, get the path, and just figure out a curriculum of what we need to do. And FDN does such a great job of that. And as we learn more and more about the functional health side of things, FDN updates the course accordingly. And so it's just, you couldn't have gone through at a better time. I graduated 4 years ago and it was super useful back then, but the amount that they've added in the last 4 years is exceptional. So when you were going through the course in 2020, what were some of the things that you maybe found on the labs that you were like totally surprised about? Because if I'm not mistaken, you did have quite a few things of your health journey, I should say, or your health story, not maybe necessarily under control, but like you knew about celiacs in you before FDN, correct?
yes.
Okay, which, hey, a lot of people don't, and then they come through here and they finally find it. I always joke that they say it's about 1 in 100 people deal with celiac disease, but in FDN, I'll tell you this, it's a lot more than 1 in 100. So it just goes to show how unfortunately underserved that community is. So what were some of those things you were finding, excuse me, once you were running the FDN labs?
Yeah, I think the first surprise was, I had already worked on my adrenal health, and about 15, 16 years ago, that had improved. But because we went down these other rabbit holes, we kind of never revisited it in my treatment. And so my adrenals are pretty shot again. And so that was really surprising to me. So I'm working on that in a variety of ways now. The other finding was through one of the GI tests is that I had some H. pylori, and I had been taking betaine, which is hydrochloric acid, and those two do not go together. So I treated the H. pylori, got off the betaine. I actually just recently brought the betaine back because now I did a repeat GI map and we're on to the next layer of the onion. So the good news is that the H. pylori is gone, but we discovered some other things. So we just keep working at it. So I think those were the two findings that were kind of surprising to me, given the amount of testing I'd had over the years and treatments and things like that. So, yep, I just keep working.
That's awesome. So on the GI map, it was like just what, not detectable or just very low that it didn't matter?
It was not detectable.
Wow.
So,
Okay. And that is big because for those listening, some might be familiar with this, some might not be. But first of all, H. pylori is so hard to find in general. And our test finds it all the time because we use a specific type of testing. I had an endoscopy and a colonoscopy, I think like 3 months before I ran the GI map. I was not kissing anyone new or anything at that time. And they did not find H. pylori when they were searching for it at the time, or at least checking for it. They did the biopsy, and then sure enough, the GI map comes up with it. I mean, that just shows like this is a tough thing to find. And so to actually get it to the point where it's no longer detectable on a test like that, I mean, that's wonderful. Did you notice any specific symptoms being relieved as that was kind of, as you were going through the protocol to eradicate that?
yeah, I mean, I did have a little bit of heartburn, but actually the symptoms weren't that much. My levels of the H. pylori were kind of low, but given my whole health history and looking at me as a whole person, my mentor said, you really should kind of treat this before it gets out of control. And I was actually surprised because the heartburn really, it was a problem, but it just wasn't that bad. But when something goes away, you're like, wow,
Yes.
that really was a problem. And it was more of a problem than I thought. So,
Yep.
yep, yep.
And listen, folks, these are the types of results that we're getting all the time. So you can drop the word results below in the comments. And we're always giving away freebies on the Real Results Show. So we'll send you our free Dress for Health Success guide. Now, Dress is actually the acronym and main principles that we use as FDN practitioners and in the FDN Thrive program. The labs are sexy, they're fun, they're cool to learn about and do, but really it is our core philosophy of getting better naturally through diet, rest, exercise, stress reduction, supplementation. That's what's going to help us the most. One of these days when I'm doing a live video, I swear I'm going to forget that acronym, like just go blank, but so far so good for using it. But anyway, again, drop the word results in the comments and we'll send that to you. But Jeannie, can you explain really quick to people why the betaine might be an issue for someone with H. pylori? Because betaine hydrochloride is something that many people are using as a digestive supplement, ironically, for symptoms that might be caused by H. pylori. So can you give us a little more insight there as why that is not a such great thing to be doing?
Basically, H. pylori thrives in an acidic environment in your stomach. So if you're just kind of fueling the fire if you're taking betaine. So it's kind of a catch 22 for many of us, but that's why you have to test and kind of look at symptoms and figure it out, right? Because there's
Yeah.
a time and a place for things. And maybe for these few months while you're treating, you don't have it. And then maybe you can bring it back later to aid your digestion later, or you can find something else to help other
Yeah.
enzymes. Yeah.
And for those listening, I mean, how do we even get something like that to begin with? Because everyone is so, it's such a new concept for people. Like, what? I have like this bacteria in my gut or like a parasite. Like, shouldn't I have some huge stomach ache every single day if I have one of those things? So, what is allowing the body to even let these things in? Shouldn't we be fighting them off?
Well, I think so many of us, I think it's a myth in our country that we don't have parasites and bacteria. I mean, come on, we're kind of made of, if you follow the microbiome, we're a big microbiome, right? Our gut is filled with all kinds of bacteria, and there's good bacteria and there's not so good bacteria. And the goal is really to have a balance. So sometimes there are certain conditions, maybe you're not eating right, maybe you're getting exposed to different toxins, glyphosate in your food, different things that can make the balance of the bacteria go out of whack. And then you end up with one of these kind of opportunistic invaders, we call them,
Sure.
and causing some havoc in your gut and other places in your body too. So,
Right. And I love what you said. We're kind of, it's just not sensible. And you kind of are living almost in a delusion to think that we're not exposed just because we're in a different country. Like people just assume that's something that doesn't happen in these Western societies. It could not be further from the truth. We might have the fortunate outcome of being able to eliminate some of these things with maybe more access to sanitization devices or wipes or whatever. Hand washing might be more available here than in certain parts of Africa, for example, right? But that does not mean these things don't exist. And, when we have compromised immune systems, like you just said, they're opportunistic. They see an opportunity, they go grab it, and they're a pain in the butt because we can be doing everything else right, and these things can still be stuck in there. So I want to focus for a second on that paradigm shift that you had, because I think that's really an important thing for other people to have. So you had been doing your career obviously for a good amount of time. Like, what was it like having to go away from maybe some of the things that you were taught or were so sure were true to try to adopt these more natural principles? Like, how did you really get past that? I don't want to call it dogma because it depends on, who you were learning from, but, certainly there's a very specific way promoted. And how were you able to get away from that?
I actually would call it dogma. I think you're right on, Evan. In our medical model, you have a symptom and you go to a doctor, and if the general doctor can't handle it, you go to the specialist, right? So each person, I mean, I realized this after I got diagnosed with celiac disease in my 20s. I was going to specialists, I was just collecting specialists, but nobody put everything that they were seeing together and looked at me as a whole person and looked at these symptoms and problems as kind of a holistic problem, or there might be a deeper a root cause of what's going on with me, rather than just kind of treating each thing, or telling me a lot of times that there's nothing wrong with me, that you're just a stressed woman in graduate school, or stressed young mother, whatever. I think we hear that so much, and kind of discounting my experience. So I think we just what happened to me is just over time, I was like, this is not working. This is not working. Nobody's kind of giving me the help that I need. And so I just started, again, like I said, reading and just trying different things little by little. And I definitely was suspicious and not quite kind of jumping on board with everything because of the way I'd been trained, in my psychology world, and and I worked in medical settings. So in my old work, I used to work in hospitals with people who had neurological problems and brain tumors, strokes, aneurysms, things like that. So I was pretty much immersed in the medical model in my work in that setting too. So I think for myself, you just keep going, and then you just start reading about. Another thing that helped me was reading about different doctors' experiences and how they had their own paradigm shifts. They, these incredible stories about, one woman cured her MS and really brought it under control, and she learned a lot about diet. I mean, these people really studied a lot about what is out there and what could help them, and they were open-minded. So I think little by little, I kind of had a shift from being symptom focused to being more health building. And then I discovered FDN, and I was like, wow, they're saying the same thing,
Yeah.
and there are all these people doing this. They're out there somewhere, and I finally found the program, and I finally found my people. So it was really exciting for me. Yeah.
That's awesome. And I love what you said about, the doctors coming out and sharing their stories with it, because I told you beforehand, I mean, seriously, it's people like you that are some of my favorites to talk to, and also nurses, because we need to be so clear. It's not a Western versus natural type of thing. That's not what this is. We are all for just using these different philosophies at the appropriate time. Ryan Monahan always says it best. I'm not going to go to the herbalist if I break my arm. That's we're not promoting that. We're not suggesting that. It's just clearly the Western system is really not ideal for a lot of chronic health issues. They're amazing for acute stuff, though. And so when you went through the FDN program, I know that you're looking to kind of expand what you do, because it gives you the ability to do that when you go through the course, right? And you've talked about so many things already. I mean, working with kids with ADHD, autism, and then other people with brain or strokes and brain tumors or whatever. Like, where are you going to go from here? Like, who do you want to be working with ideally in your FDN practice?
I think for now, I'm thinking about working with kind of women like me who've had kids, have a career, trying to balance everything, and kind of at some point get stuck. Their health gets in the way at a certain point, and they're just juggling everything. And kind of my goal would be to help them kind of prioritize. Where do I begin? How do I take care of myself? Because so many women don't take care of themselves. So many people in our society just don't take care of themselves. So that would be one thing I would like. That's one aspect of my business I want to do. And then the other aspect is somehow bring FDN to my current workplace with the families that I work with. And I've kind of started doing that a little bit because I've had some consults about mold toxicity and just shared my experience of resources of all the things that helped me when, our home had to be renovated. And, one of my children has mold toxicity. I had it. So how do you detox? How do you keep retesting and figuring that out and build health after you've gone through something like that? So yeah, I think I'd like to do both things somehow. And I'm still kind of trying to figure out how I'm going to balance it all. But I feel like I have a lot of knowledge now, so I'm excited.
Sure. And this is, I think it'd be cool to kind of spend the rest of the time here, last like 7 minutes or 8 minutes or so. So many people, especially in today's world, and those in my generation that are starting to have kids, all the time we're seeing ADHD, we're seeing autism. I mean, it is really a quite common thing. Now, we know it as practitioners, it's not normal, but it is quite common. So do you, even though you're relatively new to the FDN world to some degree, you've been studying the more natural things for a while now, what do you think is like a core theme going on? Like, why are we seeing these things go up? Because many people still to this day will promote the idea that, oh, it's just an increased awareness. There was always this many kids with autism and ADHD, and now we're learning to just diagnose it better. I think that is true, but I think it's a half truth. What's your opinion on that? And if it's the one I think it's going to be, then what is really happening with these people that's increasing the rates of these things?
I agree with you. I'm sure there is a little bit of more awareness, and there always seems to be kind of I call it a diagnosis du jour, the diagnosis of the day, the next thing. But I think it's clear that our society, we have issues. We have problems with our water, our air, our food, our homes. I think toxins. I think toxins is really the root of all of this, and unhealthy and stress. I think the kids are really stressed out with the way school is set up. Um, a lot of times there's just not enough downtime for children. There's not enough play. There are tons of books written on play and the lack of play in these kids. But I really think toxins, and if you start asking questions to the families, you realize that the parents, the grandparents, they all have issues. So once you start identifying those, you're like, okay, here's a history of leaky gut, here's a history of mental illness, here's a history of this. And so they always say, if let's say your gut's compromised, the next generation is going to be compromised as well. So I think we're just kind of at a point where there's just a tipping point where there's just more people, more children with health issues. And I think looking at it from a lack of medication standpoint doesn't help. Medicating away these issues is not going to. I mean, I've seen kids who've had severe reactions to, a lot of the psychiatric meds, and also just medicines in general. Like I have a recent case of a child who has mold toxicity and had so many steroids that his adrenals are pretty affected right now, and he's having residual problems from that. So I think there's just so many factors going on. Yeah.
I love that you brought up that generational aspect because it's something that I've seen myself. My grandmother on my mom's side, she got diagnosed with type 2 diabetes when she was around, like, I don't know, late 20s, early 30s. I mean, this is a 75, 76-year-old woman now. So it was harder to even get diagnosed back then. The ranges were different. Like, there wasn't as much awareness. And so she had that. Then my mom started exhibiting her own unique symptoms a little earlier, maybe like late teens, early 20s. And then here I am exhibiting symptoms as young as 4 or 5 years old, with various things. And so we see this go down the track. And what's so, it sounds scary, but something to rejoice in for anyone listening is that I was still able to get this stuff under control. Not necessarily easy, but it was doable with the FDN principle. So it's never too late to kind of get this started and get a move on here. For those parents out there listening that might, who knows, maybe they deal with ADHD, autism, or something like that themselves, but most likely, probably have a kid with that type of issue. Is there anything that you would say can almost be recommended generically? And of course, guys, none of this is medical advice. You always get this checked with your own doctor or practitioner you're working with. But is there like a food you would remove from these kids' diets or something you would maybe add in?
I mean, most of the functional medicine community and the FDN community, we all want to remove gluten and dairy right away. And then I always, in my personal experience, once the gluten went and then the dairy went, the soy went too. That was what happened in my house. But definitely, yeah, and getting rid of food dyes and preservatives. I mean, basically just eat real food, food that's not in a package, food that doesn't have more than, one ingredient. Shop the perimeter of the grocery store, and then also look at your GI health. Do some kind of testing because there's leaky gut is likely there in some way with these kids.
I think that's absolutely correct. I mean, I work a lot with like more mental health type of people that deal with those types of things. And I'm someone that's been there myself. I don't think I've ever found anyone that had a diagnosed mental health condition that was not sensitive to some major food like dairy or gluten, or well, actually, and dealing with leaky gut. Like, I've never seen that once in all the people that I've worked with over the last several years since graduating. So it seems like it's par for the course. Correlation isn't causation, but at a certain point, you got to wonder. You're just like, all right, well, this is coming up every single time. So that's cool. Where can people find your business if they wanted to work with you? Because you are available to work with now, correct? It's not just through FDN Thrive?
Yeah, I'm not quite there yet,
Okay.
but my website is coming hopefully the next week or two. So it'll be drjeannielopez.com. And
Nice.
right now it's drjeannielopez@gmail.com is the best contact info for me. And yeah, working on that website.
Cool. All right. Well, you guys better get ready and be, on that website, ready to contact her in 1 week. Now you put yourself on a deadline, so that's kind of good.
Yep.
That'll just be cool. I'm so glad that you are a part of this community. I love that you're in FDN Thrive and just helping people out there. So, I love when we have a couple minutes left because it makes me want to just ask random questions. I don't want to do anything tricky here. That's for sure. I guess what would a piece of advice be to, if God forbid, there are any people deep in the Western paradigm right now, they're an MD listening, they're, a nurse listening, whatever, or a psychiatrist listening. We have people like that in FDN. What would your advice to be to them so that they do not feel attacked because we're not against what they're doing, but that they can also open up this type of stuff to their patients or clients? Like, how do you help someone make that jump if it's not yourself?
I mean, I just think of it as, again, a paradigm shift, and you're really getting more tools in your toolbox. I mean, for me, as I've kind of incorporated a lot of the FDN principles into my neuropsychology practice, I've just asked more history questions. When I'm doing an intake, I ask about diet, I ask about exercise, sleep, all those different things, and I go into a lot of detail. So I think just asking more questions and being more open to looking at the individual holistically can only help your practice, no matter what discipline you're in. So, looking at our DRESS protocol: diet, rest, exercise, stress management, and supplements, maybe supplements and some supplements instead of medication.
Yeah.
Think about those and learn more. There's so
Yeah.
much to learn.
It's so funny because you like that is such simple advice, right? And I know how much knowledge you have in your head, but that's just like that's it. That's the best answer. It's not like get super complicated. It's like it makes sense. It is really should be common sense. And I would just encourage anyone just try it for 30 days.
Mhm.
If you're a doc listening, don't even put it on someone else. Why don't you try
Mhm.
eating a whole foods diet for 30 days or something, right? And that doesn't mean going to Whole Foods and buying all their processed crap that they have in their store. That means whole single ingredient foods like Jeannie was talking about, you'd be amazed what that can do in 30 days. And I think that's enough to make just about anyone a believer that, okay, there's something here. You know what I mean?
Yep, definitely.
All right, awesome. So that'll be drjeannielopez.com in 1 week from today, roughly, right? People could find you.
That's the goal.
Yes. But just in case they can contact you today through your Gmail, can you just say that one more time for people just tuning in?
It's drjeannielopez@gmail.com.
All right, awesome. Well, Jeannie, thank you so much for being here today. You know that the Real Results Show they fly by super quick. If you guys are interested in hearing more about Jeannie's career and the things that she's learned, we go super in depth on the FDN Thrive podcast. So you could search us on any major podcast platform. You're going to have to scroll down a little bit. We got like 40 something episodes out now, which is amazing. So many cool people on there, but definitely go listen to the interview we did with Jeannie. And I am not sure if I will be back as your host, but just in case if not, I've been so happy to hop on here with you guys. This is the Real Results Show, and we're live every Wednesday at 12 p.m. PST, 3 p.m. EST. So just in case this is the last time, thank you so much for always tuning in. I'm happy to talk with you guys. And Jeannie, thanks again once more for sharing your knowledge with us today.
Thanks so much for having me. It's been really fun.